have to wait. That's why we've created webinar micro lessons, short, focused recaps of our full sessions designed to help you catch up quickly and still earn your CPD points. These bite-sized lessons are available exclusively to active subscribe members. So even if you miss a live session, you never miss out on the knowledge or the CPD points. Not subscribed yet? Now's the perfect time to join. Get access to all future webinars, every micro lesson and more. Visit www.clinicalcareplatform.com to sign up today.
Now, I'm going to speak about life-threatening asthma. The patients who have life-threatening asthma, they are unable to speak. Often, you don't even hear a wheeze. That's a bad thing. It's a bad sign, which means the airway is so narrowed, it's reduced even beyond that critical diameter to produce a wheeze. They become drowsy and confused. And this is one of the classic things. A patient whose GCS was reasonable, they were wheezing, and the next second, boom, they are obtunded. And you find that they are going to be hypoxic and the CO2 is rising. They can become bradycardic, they become hypotensive, they become hypoxic. And usually your peak expiratory flow is less than 33%. You want to intubate and ventilate those patients, no questions asked. This 6 is not routine, guys, because asthma exacerbation is a clinical diagnosis. So don't wait to intervene. Don't send the patient for chest X-ray. You'd rather have them sitting there on the nebs than having them off the nebs and being sent for a chest X-ray.
Yay! Welcome, colleagues. Good evening. I hope you are well, you are warm. And yeah, thank you for joining us for what we call an information session. These are sessions that we put together to sort of brief you on some of the programs that we have for you. But it's also an opportune time for you to ask questions that you might have so that you have clarity, especially if those questions can help you to make the decision as to whether you'll be able to join us or not this coming Saturday. As always, I always bring backup. So I am, what happened? Oh yeah, I am not alone. I'm with Dr. Raizwe Pesat, a brother of mine. Welcome, welcome, brother. Are you well?
Well, thank you. How are you, brother?
No, all is good. It's very interesting. I haven't seen you in a while. I'm so used to to seeing you at least every week
Ooh,
teaching. And I can see the way you look. This one has been resting. You are looking good.
thank you, brother. You too. You too.
Awesome, colleagues. Yeah, so this is an information session. We usually do it in 3 parts. The first part, I'm just going to brief you a bit about the platform and what we are all about. Then I will hand over to Dr. Swepesa to take you through what you can expect on Saturdays, particularly about the Pulmonology Masterclass. Then I'll show you how to navigate our website so that you can register and not miss this particular event. Then we'll have a Q&A session at the end for like few minutes to answer any questions that you might have. So let me then share my screen Give me a few seconds to find my slides. There we go. So yeah, I hope you can see the slides. I have a lot of windows opened here, but I'm hoping I can do that. Okay, actually, can I close? Okay, give me a few seconds because I think my network is also a bit troublesome. Okay, yeah, so just to introduce you to CCP in a few slides, and then we take it from there. Just to say that as a platform, our mission is at the heart of everything that we do, which is to improve patient care. And programs like our master classes are very important because they get us closer, to being very, very competent as health professionals. So I think these are sessions that you must take a little bit seriously and try to make time, time and again to join so that you can be very confident in your core work. These are sort of our service promises and standards. We aim to be simple, fast, and efficient. I always say these are aspirational because every time when I read them, I realize that we are very far from them. But this is what you can hold us accountable on, to say, but you said you are simple, but your processes are complex. You said you are fast, but your certificates are taking a month. We try to be responsive to your needs, but also provide educational programs such that they allow for flexibility. That means you can still learn regardless of where you are, rural versus urban. Distance is not an issue. We eliminate the cost for in-person events. Hence, we have adopted the virtual way of teaching. And you'll find that through various initiatives, we are starting to form very good relationships. Our teachers are experts in their field, but they also now start to become very, very comfortable teaching online because they get used to it. And we hope as well that through these engagements, we help you to enhance your career and help you to achieve your professional development goals. We are a membership based platform, and this means that we we want to help you to transcend the need, for example, for CPDs. I always say we want you to focus on, what do I want to be good at? And if that is child health, let us help you to do that without you being worried that you're going to be deregistered by the HPCSA, as it's happening this week. We have a lot of inquiries, and I'm like, but if you say you have attended all our webinars last year, and because now you're being audited, they say, hey, let me be a member. I'm like, but why? Why do you want to put yourself under so much pressure? Just join the platform, support the work that we do, and we'll bring you great educational content and ensure that you have a peace of mind. Our membership offering includes other additional benefits which you can read about on our website. Just to say that we use the term masterclass to define what would be an intense, evidence-based. Generally, most of them are held as a virtual event. These are high-yield events, a lot of information shared over a short period of time. Hence, we also make the self-paced versions of this program available to you for at least a year after your registration. So even if you know that you're not going to be able to attend fully on Saturday, or I don't know, you won't even be able to attend, register. You'll get access to the self-paced version after that, and then you can then at your own pace play, rewind, and fast forward Dr. Swepesat as possible. And all our events are CPD accredited, and we report on your behalf directly to the council. And we really, really look forward to see you then. The list of available masterclasses is actually growing, but today we are focusing on the FCP Part 2 for internal medicine, particularly on pulmonology. But we do have other general masterclasses in internal medicine, and there's one coming your way in July. Still need to verify the date with Brother Ryan, but I think it should be okay once we agree. So this is what you can expect. Oh, This is still written cardiology. I don't know what happened. But anyway, this is pulmonology this coming weekend. Cardiology was our previous one. I think there was a typo there to edit this. And our next one would also be towards the end of July until we complete the series. Just to say as well, we do have a coaching program in the Diploma for Internal Medicine. We have actually just concluded our third cohort, and they are going to be writing in the next couple of days to weeks. If you are interested, be ready, save up a little bit of money. Join us when we announce the fourth cohort towards the end of the year, probably in the next 2 months or so. That is for those of you who would love to write the February 2026 exam, but also many people just join just to improve their knowledge and competency in internal medicine. And yes, we are loved by many. But at this point, I won't read the profile. He is our physician, in-house physician here at CCP. Let us hand over to Dr. Ryan Swepesat to take us through what you can expect on Saturday. Brother Ryan, can I hand over to you? Thank you.
Yo. Thank you, Brother Moela. Good to hear
Welcome.
your voice, man. I've been having withdrawals. Missing hearing your voice.
Awesome, awesome.
Brother, can everybody see my slides and hear my voice? Can you give me a thumbs up if you can see my slides?
Yay, we can see. Awesome.
Okay. Good evening, everybody. Warm welcome. Thank you so much to Brother Mawela and the good folks at the CCP for inviting me over to talk about the info session for this Saturday. Hope everybody's good. Hope that you're nice and warm. And I'm here in Durban, and Durban is the land of perpetual warmth. So wherever you are, I hope you're warm and safe. Yeah, pulmonology. Do you know there are many different words for the lungs? I just can't remember them because I have bad long-term memory. Yeah, a little bit of a joke to get started off. Yeah, everybody. So FCP2 Masterclasses. This is our 6th so far. Thank God for that. And we are still moving on. Who is this course for? It is for obviously candidates who are sitting for the FCP2 exam, but not just for them. It's also for those in a registrar post who are not yet eligible to write, but will be writing soon. For medical officers looking to upskill themselves, to improve their knowledge base, their clinical acumen, to get ahead. And even if you're an intern or a ComServe officer who has special interest in medicine, this is for you. Now, while we're talking about that, if you're in doubt as to whether you're eligible to write Part 2, one of the HPCSA and College of Medicine requirements, so 30 months in a numbered registrar training post, all right? A letter from your head of department confirming that your logbook has been submitted and accepted. Okay, what's the format of these exams? Well, there's a theory portion which consists of 2 multiple choice papers with the best of 4 format. There's 75 questions, 3 hours each, followed by an OSCE, which I think is 2 hours, where you'll be presented with data interpretation, chest x-rays, ECGs, blood gases, lung functions, pitches, etc. Okay, and then of course the clinical thereafter. So if you pass these 2, then you'll be invited for the clinical, and that will take place at your local regional center. And if you pass that, then of course there's a structured oral examination that follows, which is over Zoom format, and you'll be exposed to a variety of questionnaires from around the country. Okay, so whatever you see in red is going to be covered by the masterclass sessions here on the CCP. Why on earth have we designed this course? What's the rationale for this course? Well, as we know, as a busy registrar in internal medicine, there is never, ever enough time for anything. You're always chasing your tail. Okay, you got busy calls, you've got journal clubs, academic presentations, you always got the med niggling at the back of your mind. You got family commitments, you got religious commitments, you got other things. It's a delicate balancing act with life. Okay, and the lectures that we are designed here are casual yet concise, focused on medical knowledge that you need for boards, and not just for boards, for practice with everyday patients in internal medicine. It reflects the most current standard of care as per the most recent guidelines per discipline, and it cuts through the clutter and makes learning as easy, as high yield, and as stratified, as simple as possible. Okay. So what do these classes cover? It's an intense revision and summation of core knowledge that you need to sit to write the exam, separated into different organ systems. And it covers examples as well. Besides the theory, we cover examples from each of the modes of questioning, like MCQs for the theory, a whole truckload of OSCE scenarios, and of course, some specially designed structured oral exam scenarios. So those of you who are confident enough to say, hey, give me a trial, I want to get those oral questions, try it out, you're welcome to come and answer questions, and then we'll critique your approach as we go along. Okay, it's approximately 7 to 8 hours per class, but hey, you know what? Even when it comes to pulmonology, even with cardiology, even with endocrine, there's just not enough time to cover all the theory in the allotted 8 hours. So as with Dr. Mawela, we discussed this, I will do some topics as self-paced video classes, which will not be discussed on Saturday, but that you will have access to those just because it's not possible to cover everything in 8 hours. Okay. So our planned master classes. So you know, guys, we've already done with these five, the big five. Heme, nephro, rheum, endocrine, cardiology. This Saturday is pulmonology, crit care. Then, God willing, July will be gastroenterology, and then come August, I'm combining neurology, stats, and dermatology. All right, but Saturday is all about the lungs and a little bit about crit care because those two kind of go together like peanut butter and jelly. Okay, this is the game plan for Saturday, guys. Whatever here you see in purple will be available as self-paced videos on the CCP site. Okay, so even though the stuff is examinable, we're not going to cover it on Saturday. So respiratory physiology, talking about oxygen content, alveolar arterial gradient, etiology of hypoxemia, together with an approach to pulmonary function tests, tuberculosis, okay, and then sleep medicine, but on obstructive sleep apnea and that kind of thing. Those topics are definitely going to be available as masterclass, video masterclasses. But what we're going to cover on Saturday, hopefully, in terms of the theory, is going to be asthma, COPD, bronchiectasis, with a special emphasis on cystic fibrosis. Then we're going to cut through interstitial lung disease, pulmonary hypertension, pulmonary embolus, and DVT, which go together. Okay, pleural effusions, pneumothorax, pneumonias, a whole truckload of pneumonias to talk about. Critical care medicine, there, of course, there's a bias towards ARDS. So we're going to not cover all principles of critical care because that itself is another topic for another day. But we're just going to home in onto acute respiratory distress syndrome and ventilator management and early goal-directed therapy in the ICU. Okay, then of course we have to discuss lung cancer, very topical, together with nodules. And we're going to allocate at least 3 hours to the structured oral exam and the OSCE together. All right. That's our game plan. So just to give you guys a small appetizer as to what we have to offer, this is something taken from the theory. So just touching on sarcoidosis, we go through a definition, what characterizes the disease. So these are very, very high yield, stratified, summarized points that you need to know, not covering it in totality, but giving you the hardest hitting points you need for the exams. Okay. Clinical manifestations can involve almost any organ system, ocular, skin, myocardial, rheum, GI, CNS. Lung involvement is the commonest, which is why the pulmonologist actually is the main person to deal with sarcoidosis, even though it's a multi-systemic problem. We're going to go through chest X-rays and CT scans, and then we're going to talk about, for instance, 2 distinct syndromes, which are very high yield for the board. They always love to throw in Lofgren syndrome and Hirschfeld syndrome, and we're going to contrast and compare those. Looking at making the diagnosis, you need to exclude other granulomatous conditions, especially TB, okay? Borreliosis, hypersensitivity, pneumonitis. We're going to look at a bronch and talk about typical characteristic of the bronch. How do you treat that? Okay, steroids are the mainstay of treatment, but we cover that in detail. We look at indications for steroids in the context of different organ manifestations. We look at the role of steroid-sparing agents. Of course, steroids are not innocuous drugs. They cause a whole lot of side effects long-term. And so we're going to talk about the different steroid-sparing agents we have available. Okay, and this is an example of a poll question. 55-year-old female evaluated for 10-month history of cough and dyspnea. She reports no other symptoms, no medical problems, and takes no meds. She is a former smoker. See, and I kind of like outlined in purple the high impact words. I'm going to take you guys through a way of thinking through MCQs. There's a technique for answering MCQs, and we'll go through that and flesh it out with many examples. On exam, very important, she has no pits. On exam, blood pressure looks good. She's not tachycardic, slightly tachypnic, but she's obviously hypoxic. There's no jugular venous distension. That's important because it's talked about right heart pathology. Cardiac exam, sorry for the typo, is normal. Lung exam shows bilateral inspiratory creps at the lung bases. The clubbing is present. And the PFT shows you a decreased TLC, decreased FEV1, decreased forced vital capacity, normal FEV1 FVC ratio, and a diminished DLCO. CT scan is done, and then we look at the CT scan, and then we talk about the image that's there. And then we pose the question, what is the most likely diagnosis given all the clinical information? Is it emphysema, heart failure, hypersensitivity pneumonitis, or is it IPF? And of course, for those of you who are going for exam, you know the answer is IPF. And we'll talk about why that is the case. And then we'll also discuss why the other options are incorrect. Okay, and then it's an example of I. So we talked about the question, the answer to the question, then we zoom into what the correct answer is, talking about IPF and so forth. Okay, so that was the theory. An example from the OSCE is as follows. So in the OSCE, they're going to give you guys data interpretation, right? So this is the typical flow volume loop. The inspiratory curve is on the bottom, the expiratory curve is on the top. And this is typical scooping that we see, typical of obstructive lung disease. So obviously this is, talking about COPD and asthma, the two brothers. Okay, and then we talk about the role of steroids and so on. This is an example, guys. For those of you who are familiar with ECGs from the ECG Masterclass, yes, dominant R in V1. Why is the R dominant in V1? What is wrong? It's the differential for dominant R in V1. This is a classic for the OSCE and the FCP. They love to put in their dominant R in V1 with RV strain and right bundle branch block and S1Q3, T3, and so forth and so forth. Okay, and then the SOE. This is an example of a structured oral exam question. Mr. Governor, 45-year-old male, lives in Chatswood, KZN. Self-employed, sells DVDs and samosa. Mutton, potato, tin fish. He shares a 2-bedroom flat with 9 other people, has access to all amenities. He has previous TB ×3. Oh dear. Diagnosed at Helen Joseph Hospital. Every time his sputum was gene expert negative and sensitive to rifampicin. He has completed 6 months of TB treatment on each occasion. He's HIV negative. Tested last month at the local clinic, sober habit, smoker of 3 cigarettes per day. Now he says, Doc, I have chronic productive cough with white sputum. Recently, his sputum turned yellow, and he noticed an increase of very voluminous sputum, worsening shortness of breath, fever. You hear bilateral cough crackle. He was referred by the GP to you for further evaluation and management. Then we go on to look at some images. Okay, you got a beautiful chest X-ray, you got a CT scan, you got, look at this clubbing, drumstick clubbing, and you got a beautiful specimen of sputum. Ew. Right? White cell count is 20, HP16, platelets 200. You got a couple of results here. You got sputum, you got blood culture, etc., etc. COVID-19 is negative. And then we pose a variety of questions to the candidate. Okay. And you guys can see the questions. Okay. We're going to zoom into those pictures. We're going to talk about the diagnosis, talk about the underlying pathophys, different. So this, in essence, is a summation of what is covered in the theory. Okay. And then the question goes on. This patient is developing hemoptysis, and very common. Now, this is a very common clinical scenario. It's based on an actual patient. Okay, medication is called to assess his condition. Now it's hypotensive, it's becoming tachycardic, it's hypoxic. Okay, and you've got hemoptysis on board. Now we talk about hemoptysis, principles of managing hemoptysis, right? Okay, and of course you notice that this is the case of bronchiectasis. And we go through and we break down bronchiectasis in terms of all the questions. We go through the model answer. Okay. So guys, just in summary, this is meant to consolidate, not consolidation on the X-ray now, consolidation in the way of bringing everything together. Right? The course is high yield and intense. It covers core concepts, which is essential for your success in the FCP2 exam. It's designed to maximize your ability to recall knowledge, to apply not only to the board, but also with your patients on a day-to-day basis. One more joke to close up. A boy asked a doctor why he felt like a pony. The doctor said it's because you're a little horse. Brother Mamela, over to you.
The doctor needs help. All right, colleagues. You can stop sharing, brother.
Oh yes, sorry.
Yeah, sure.
Evo, you.
All right, colleagues, I think you know that I've been doing some videos. Here's one for you.
This is a beautiful slide, guys, because what we've done is we've taken the signs that you elicit in the respiratory exam, we've plotted it on the left, and on the other axis, we're looking at specific lung conditions. So, for instance, pneumothorax, right? It's rupture. You guys know it's A in the pleural space, okay? Okay, on percussion, it's going to be hyperresonance, okay? The A is in the push the trachea, so it'll be contralateral tracheal deviation. versus pleural diffusion. And of course, you guys know Light's criteria. When you percuss, it's going to be stony down. When you trachea may be deviated, it pushes the trachea to the opposite side. So consonantal tracheal deviation.
We stop right there because it's just a highlight, colleagues. I hope you have gathered what you are likely to miss. If you don't miss it, what you are likely to enjoy on Saturday. I just want to then take you through our website. Let me see if this is going to work. Okay, let me just give me a few seconds just to see for the online people if there's something I can do for them. Oh, not really. Okay, I wanted to. We have okay, let me see. No. Okay, because we are streaming this thing, but I'll learn later how to handle this one. We have few people joining on the what you call on our Facebook page, but it's okay. Yeah, just to say that this is our website. I'm on the home page, and if you would love to then explore this particular course, you just scroll downwards. You would see FCP Part 2 Pulmonology Masterclass. It's on our homepage. There's a Learn More button which you can click. It will take you to the course page. Alternately, if you look on top on the menu, if you're using your phone, this would be on the side. There's a menu item written workshops. So you then click on that particular page. And there you go. Today's information session is there, Pulmonology Masterclass, but we also have the actual event on your right-hand side happening on the 28th from 8 o'clock. You just click anywhere on it. It will take you to this page, because on this page there's just a little bit more information about the course, what you can expect, what topics are going to be covered, and also the price, which is 950 per registrant, and that if you are an active member of the platform, you can use the code member25. I'm going to copy it for myself, right? And then you have once you have made up your mind, you can either use this button on top written book your seat, or even just to say yes, I'm ready. Either of the two is fine. It should take you then to the payment page where you're gonna put in your information. So like now, mine is already pre-populated because my computer knows me. But just to explain that on top here, there's 2 additional events that you can actually register for. The first one says add the upcoming masterclass on clinical laboratory test interpretation. And then you would save 100 rands if you register for both at the same time. The same applies if you register for the July masterclass on gastroenterology. So for example, if I click there, right, you would see that if you say 950 plus 950, it's supposed to give you 1.9 or so. So you have saved the 100 rands, right? You can click both, or if you are only interested in the gastroenterology one, you do the same. Now, just below the total fee, right? If you want to pay with a different currency, this is for our people who stay outside South Africa, you can look at that. But I want you to pay attention to the apply coupon code. If you are the member, if you are an active member of the platform, you just type in the member 25. This is capital letters, right? And the number 25. Make sure there are no spaces and there's nothing before or after the member 25. Then you say apply for your 10% discount. Do you see that it says there's a discount, right? And you have now even minused a further 100. And I see many people are using this so nicely. That's the benefit of being a member. Then you just complete your contact number, your council registration, and then you can select your country if you're outside South Africa, and then continue to pay, right? This is a secured site. The payment processes are not processed by us as a platform, but we use PayFast, which is our payment gateway. It is a generally trusted platform, particularly here in South Africa. I think they are the leading online payment processing platform. So rest assured that your information will be kept secured. So to save, register for more events, but then apply the member 25 code if you are an active member. If you're not a member, don't apply it, because when you register, we'll still ask you to pay the difference. It will just create some stress for you. Okay, so now I know why people couldn't see. I hope you were able to see the website. Brother Ryan, I don't know if the website was visible, because I see this thing had the spotlighted. I hope you are good. All right. So yeah, maybe at this point in time, colleagues, let's take some questions from you, just to get a sense of where you are. Brother Ryan, are you able to hear me?
Yes, perfect, brother. Perfect.
All right. I need to shift away from. Oh, I think I'm the one who's not doing this thing correctly. But now I can. Let me go to this one and get Brother Ryan on board.
Oh, yes.
Yay! Both of us are there.
Yay.
All right, awesome. Colleagues, what questions do you have? So, Brother Ryan, I see a Pete's question here already. Edwin says, for someone interested in pediatric pulmonology, will the masterclass be beneficial, or rather wait for the pediatric one if there will be any? So, Edwin is also questioning whether we will ever have a pediatric version of pulmonology. Yeah, Brother Ryan?
No, brother Edwin, this is geared towards adults, brother. I don't want to promise you that we'll be covering pediatric populations. The pathology is vastly different.
Yeah.
So I would probably say no. It's a qualified no, because some things may be relevant, some things won't. But for the most part, it's related to adults. So I wouldn't encourage you. If you're coming in thinking about peds, this is not the masterclass for you.
Awesome, awesome, awesome. Thank you, Brother Ryan. There might be other professionals, Ryan, just to check if there's any benefit for them, like someone who is already a physician and they're thinking, okay, I'll get CPDs, but is there anything else I can get out of this as a qualified physician?
Yeah, brother, knowledge, they say only knowledge that is used sticks to your mind.
Yeah.
And so many of us probably knew the spectrum of all these disorders back when we wrote our FCP. But over time, it tends to erode a bit. So this is a nice refresher, especially if you have an affinity for lung pathology. This is a great refresher for you. Yeah.
Awesome, awesome, awesome. Yeah, and then I heard you sharing your own personal experience to say that when you were a registrar and how difficult it was, between being on call, doing post-call rounds, and there's family, and now you have to do your part one, you must do your part one, part two. If this program was there during your time, what would have been the impact on your studying?
Oh,
Yeah.
man. This would have been amazing. Because, brother, the prescribed textbooks for registrars is Harrison's Principles of Internal Medicine. Have you seen that? It's like 2 directories.
Yeah, it's big. It's
So,
big.
I mean, something like this really stratifies things, makes it high yield, really narrows it down to giving you what you need to pass. I would have jumped in both hands. Give it to me.
Yeah, and colleagues, I see there's some of you who have actually been part of the previous master classes. I think we did cardiology, rheumatology, hematology. What else did we do? I mean, we did a lot already. so
Endocrine,
so do type
endocrine,
in the
yes.
chat, your experience of these 1 day events and the impact it has had on you. Yes, maybe you haven't written the exam, but maybe during what rounds, when you see a patient the impact on that patient, but also your confidence during those grand ward rounds when you are put on spot and you are asked questions. I have faith that this is not just about the exam, but it's a program that is meant to elevate you, to make you very, very confident, and just to enjoy your work. Some of you, I know you, otherwise I'll call you by name. I know that some of you are not even registrars, but you are a medical officer who's been in the internal medicine ward maybe for 10 years, and you're thinking, no, man, let me elevate my lead in this space. And then, boom, your patients are getting better care, your patients are being discharged. Brother Ryan, do you think this is beneficial for me, Dr. Mawela, the chronic medical officer in internal medicine? I don't want to become a physician, but I'm seeing patients every
Yes.
day. Yeah.
Yeah, absolutely. It's gonna sharpen you. It's gonna sharpen your sword. It's gonna give you more tools for your toolbox.
Yes.
It's gonna make you more competent, more confident, and
Yeah.
yeah, I think it'll be a big help. A big help.
Awesome, awesome. Yeah, so colleagues, from an administrative point of view, just to respond to some of the common questions we usually get, the first thing is that yes, these events are CPD accredited, and anyone who has paid, right, who attends adequately, because CPDs they require you to participate in the educational event. As long as you have met those two criteria, whether you're a member or not, this is a paid event. Members will get that 10% discount. Non-members will pay the full 950. So you must have successfully registered and you must attend adequately. You will get your certificate, right? The other common question which we get is, well, I'm not available on Saturday, but I'm interested in the content. Yes, do register. A few days after the event, we put together all the content and it becomes a self-paced version of the course, which then you can access. Ne? You can access and you can study self-paced e-learning, and it's nice because then it's convenient at your own time, and Dr. Ryan, he can be fast, so you can slow him down, you can rewind, you can fast forward, you can also pause. Dr. Swepesat, but also it allows that huge
Yeah.
volume of information to be processed, slowly. And to say as well that anyone who registers, so the self-paced version is not only for people who miss. So even if you did attend successfully, you will have access to that version of the program. The other thing which is just recent, we have now made available all previous FCP Part 2 masterclasses for you to be able to access them. So if you are joining us for the first time and you're like, where were these guys all along? I'm writing next week, and I've missed cardiology, hematology, nephrology, all those kinds, endocrinology, big, big, big topic, they are all available. So just drop us an email and we will be able to help you, because I didn't prepare the link. But otherwise, everyone who has attended here, I'll send you an email with that link for all the previous master classes. Maybe select the few which you feel that's where maybe you want to strengthen your capacity, and then go through them. And hopefully you still join us this coming Saturday. The last thing is Monday is the due date. Monday, Brother Ryan, is the due date. Is the HPCSA due date for compliance. So that's very, very important. We've been getting a lot of questions, people saying, hey, do I submit my certificates or do you submit? I can tell you, you can't submit your own certificates. We submit them. As far as I know, we are very efficient. I mean, we had a webinar, yes, last night. As far as I know, the CPDs have been submitted and reported, So that's how efficient we are. So do attend on Saturday. Maybe your first goal is to get the CPDs, but I'm hoping that you'll stay through and acquire the knowledge. Monday we will report, hopefully by the 1st or something, you get your CPDs and you are compliant. So this is the administrative part that we are trying to help you to not worry about by being part of this platform. Now, our members have 300 CPDs. I was checking my profile. I don't count anymore. Even the SMS from HPCSA just said, Dr. Mawela, we don't want to stress you. Please just enjoy your day and rest well. They didn't tell me about heavy sports and stuff. All right, colleagues, that's it for tonight. I hope you are well. Brother Ryan, your closing remarks?
Oh, thank you, brother. Thank you, everybody, for taking the time to join us. And I hope that you're convinced that you'd love to attend the masterclass. We would love to have you there.
Yeah.
And Brother Mawela said he'll organize virtual refreshments for everybody.
Yes.
Thank you.
Steak by email. Colleagues, don't go. Let me show you another clip snapshot.
Now, I'm going to speak about life-threatening asthma. The patients who have life-threatening asthma, they are unable to speak. Often, you don't even hear a wheeze. That's a bad thing. It's a bad sign, which means the airway is so narrowed, it's reduced even beyond that critical diameter to produce a wheeze. They become drowsy and confused. And this is one of the classic things. A patient whose GCS was reasonable, they were wheezing, and the next second, boom, they are obtunded. And you find that they are going to be hypoxic and the CO2 is rising. They can become bradycardic, they become hypotensive, they become hypoxic. And usually your peak respiratory flow is less than 33%. You want to intubate and ventilate those patients, no questions asked. Just X-ray is not routine, guys, because asthma exacerbation is a clinical diagnosis. So don't wait to intervene. Don't send the patient for chest X-ray. You'd rather have them sitting there on the nebs than having them off the nebs and being sent for a chest X-ray. So this is a beautiful slide, guys, because what we've done is we've taken the signs that you elicit in the respiratory exam, we've plotted it on the left, and on the other axis, we're looking at specific lung conditions. So, for instance, pneumothorax, right? It's rupture. You guys know it's A in the pleural space, okay? Okay, on percussion is going to be hyperresonance, okay? The A is in the push the trachea, so it'll be contralateral tracheal deviation. Versus pleural diffusion, and of course you guys know Light's criteria. When you percuss, it's going to be stony down. When you trachea may be deviated, it pushes the trachea to the opposite side, so contralateral tracheal deviation.